Good afternoon, ladies and gents. Thank you for the introduction, Stuart. Much appreciated. My name is Chris Hyde. I'm from the Royal Surrey County Hospital down in Guildford, for those who don't know. With me this afternoon, I have Anne Spence, who is the Programme Director of Patients First, and I'll tell you a wee bit about Patients First in a second, and Chloe Tonks, who is the C3I Administrator, who basically does everything, and I just seek all the glory. So let's put it there. Okay, I'd like to tell you a bit about the C3I programme. C3I, as it says, creating a culture of continuous improvement, and love the job title, because I always have to go around and explain what C3I is, or used to, because now we're starting to see a massive change in the organisation. So what's C3I all about? Creating a culture of continuous improvement. It's really simple, isn't it, to change a culture in an organisation? Yeah. Absolutely. It hasn't been without challenge, and I'd like to say that we're almost there. I think we've still got a way to go, but we're making headway. And actually, we echo from the previous presentation as well. I think there's lots of similarities there. Constantly working towards a safe and efficient environment, and that word safe, that springs up time and time again, and I think we'll all agree, it's core business. Training and developing our staff, and taking them to various levels, embedding continuous improvement throughout the organisation. And that word embed will come up time and time again throughout this presentation. And embedding change leaders. Embedding change leaders is important. We can all parachute a team of specialists into a department. They come in there, they do the change, they clear off again. Does it actually sustain? Does it create a barrier? Do you like somebody coming in and doing change to you? No, you don't. But actually building a change leader in your own department, within your own organisation, it actually makes it sustainable. So that's what we're about. Our trust strategy, this is fairly new. Around the outside, our values. Safe and excellent care, continuous improvement, and that one right at the bottom underpins everything, respect for people. And those of you, lean background, obviously, all familiar here, respect for people and waste elimination are the two main things. The bits throughout the middle, the strategies, best outcomes, excellent experience, skilled, motivated teams, and top productivity. Everything we aim to do within training fits into one of those themes or multiple themes, because that's what we're aiming for. And of course, right at the top, patients, and that's who it's all about. C3I programme, three main strategic work streams. The first one, which I've talked briefly about in the introduction, building change leaders, and that's getting them everywhere throughout the organisation through what we consider to be a world-class development programme. Realising the benefits for the patients, that's achieving outstanding improvement in patient care through the projects that have been delivered through C3I capabilities, and that's C3I creating a culture of continuous improvement. I will bang that home. And creating opportunities, becoming a national beacon for our approach to improving patient care, making the most of C3I capabilities within and beyond the Royal Surrey. And actually, since I joined the programme in July 2011, we've started to go outside our own boundaries now. We have about 3,100-ish whole-time equivalent. So in the big scheme of things, not as big as you guys with your 9,000, but even having 3,000 people has its challenges. But as we all know, healthcare, it's evolving, it's growing, and we're starting to look outside our own organisational boundaries now. So, our training strategy. Basically, we deliver three levels, which we've put into a belt system. The first one being an awareness level, which is white belt. Second one is yellow belt, and the third one is green belt. Ahead of that, we do actually offer, it's compulsory, an hour's induction, where we deliver to everyone who joins the organisation. I'll talk more about the belts and the levels a wee bit later on. We also deliver bespoke, lean and continuous improvement training for departments and organisations. We have a team of 9 change leaders within Patients First team. They are assigned to different projects and they go out there in the organisation. What we can support as the C3I programme is when they're delivering to a group of people, we can create a bespoke training package that actually is not just off the shelf, it actually is put into context for the people that are out there. So, for instance, a few months ago, one of my colleagues was doing some work about process redesign in medical records. We went in there and we talked about one-by-one flow to the medical records people. We did a very simple example, shifting some tennis balls through a load of baskets, etc., etc. It helps to embed the learning, it helps to embed the change process. We did a merger between two departments, our surgical assessment unit, medical assessment unit. We went in there, we talked about lean methodology, again talking about flow, creating, establishing pull, etc., etc. It helps to smooth the way for our change leaders coming in there to do the job. Having that flexibility is probably key to, one of the key reasons for our success, that we can be flexible and change things. Project mentoring and support networks. As you guys said from the Northumbria way, we don't just train people, send them off into the ether and thanks very much, that's job's gone, another tick on the board. We support them every step of the way, and various methods that people can obtain help from Patients First and from the C3I programme. Essentially, it's like a help desk system. They either phone through, email, or use our intranet systems to contact myself or Chloe. We then understand what the problem is, and we may be able to fix it with a phone call, or we can draw on the experience from our team, some of which have more experience in data analysis. So if it was something like charting or something, I'd put somebody in. If it was a softer skills, we'd choose someone else, etc., etc. So we can draw on experience and start to unblock some of these problems that people come up against. So the support network is there. Leadership development is an important part. It's integral to the whole change process. To give somebody or encourage them to use different styles of leadership to enable a change process to work is a real part and parcel of our whole training programme. So that's in there right from the beginning. And lastly, additional training packages. As well as the awareness level, the introductory and the intermediate, we can also provide things like human factors training, benefits realisation training, and we use another vehicle which I will talk about a wee bit later on, our C3I alumni, which is when people have been through our training process, they have something to come back on and refresh their skills, keep them up to date and move them forward. So that's really the training strategy. The key points delivered in all of our training events. Obviously, knowledge of lean principles, tools and techniques. Yeah, you can send people off with a whole load of tools. That's grand. But how do you use them? Well, we give them disciplined project management, so you know how, cradle to grave effectively, how to deliver a project. Use data to inform decision making. Oh, this is one of my faves, yeah? How many of you heard, I've got a gut feeling this is a really good idea, gut feeling, right, plough on, yeah? Great, you may have a gut feeling about something may need doing, but let's have a look at some data. And we're not just talking about getting reams from informatics, we're talking about going and seeing the Gemba, getting real evidence to base your decisions and take it forward. And we give this advice to all of our students, every single one of our training events. And lastly, effective team building and facilitation. Hopefully, when they come on one of our courses, they experience what facilitation is like and what good facilitation looks like. But we also, we're a strong believer, we give them the pen. It's a safe environment. They can test their skills out in a safe environment before we send them out there. And again, as I said, full training, mentoring and support, so we're not just flinging them out there. This is the methodology that we use. It's called Decoder. We are really, really proud of it at the Royal Surrey. It has been developed by us. It is essentially standardised, easy to follow, adapted for the healthcare setting. You will see things like, I think, oh, that looks like DMAIC, that looks like PDCA. Yeah, it does. because it's been adapted from all of these models and used for healthcare. So it starts off define, establish, create, organise, do. That's often where projects stop. And then the last bit, evaluate and refine. That closes the loops. That brings everybody round. So just a wee bit of detail about Decoder, because I'm very proud of Decoder. Define, that's when you focus the team. You have your gut feeling, get it out, get your project team set, get the idea out there, have an idea what your benefits are going to be, etc., etc. Establish, this is when you use your data, actually confirming what's going on. Let's find out what's going on, let's test our assumptions. It could be at that point, once you've done that, actually, we don't need this project, and it stops right there. However, if we've found out what's really going on, we've root caused it, etc., etc., that may bring up our issues, so we go on to the next stage where we start to develop solutions. Once we've developed solutions, then project management really comes into its own, because we start to organise how we're going to deliver it, and the bit where people run for the hills, the do bit. Yeah, this is the time to make things happen, the implementation. And as I said in the previous slide, it's not just enough to do it and stop there. The last bit is the evaluate and refine. So not only do you check that you've actually achieved what you set out to achieve, and sometimes we don't, but it gives you an opportunity to PDCA, plan, do, check out, and go back and try it again. But we learn from it, and we share that learning. And that's why C3I is really important, because we are a repository for that learning, so that we don't just have all of these pockets around doing little projects and learning stuff along the way. We actually bring it back together so that people can share and learn information. So our 3 training programs, white belt training. This one has been running now since December 2011, 3.5 hours worth of training. It's classroom based, it's a course for absolutely everyone, and I've done the data analysis on it, and we've had from band to in fact governor level now, I suppose. So literally everyone. I've had consultants in there moving tennis balls around. I've had porters moving tennis balls around in the same room together. It's fab. It's there to build an awareness, but mainly to get people enthused, to get them involved. And also, I don't know how many of you in the past have sat in a meeting and people start using jargon, 3-letter abbreviations and things like that, and you think, oh, I really must ask. And before you can ask, the moment's gone, and you sit in the meeting and think, well, I can't say anything now because I feel a little bit daft, and the meeting's gone on, and you felt disengaged with the whole process. This course is designed to de-jargonise, so that people feel empowered to actually make changes in the workplace, empowered to be involved, and hopefully encourage them to have the autonomy to not just see a problem and go, that's a problem, but actually have something structured so that they can fix that problem and have a recognised methodology like Decoder to work through it. So that's the 3.5 hour course. No prerequisites with that at all. The second one is yellow belt training, a 2-day course, and preferably we take people off site to do it. We take people through a simulation exercise, and it's a very simple simulation, and it's a complete leveller. It's not healthcare related, and it involves putting little pretty dots onto a bit of paper, sticking them down. And it's a chaos system, absolute chaos system. But over the course of 2 days, our students work through the Decoder process. At the other end, they come back with a flow system that actually works, and they can relate it back into the healthcare setting. But we don't just say, that's your 2-day course and that's it. What we ask them to do as part of that course is to go off and deliver a small, and we use that word specifically, small, change project within their own working environment. And preferably that small change project should take no longer than 5 working days maximum, between 3 to 6 months. And the reason we say within your own department, because as soon as you start stepping outside of your own borders, you start stepping into other people's world. And if you're going into other people's worlds, there's a good chance you're going to start to hit barriers towards change. So we want this to not only be a learning experience where they embed the actual Decoder learning and how to use lean tools and collect data and all of that sort of stuff, but we want it to be a good experience, because if it's a good experience for people, they'll want to do more. And if they want to do more, you embed the philosophy. And if you embed the philosophy, guess what? We've changed the culture. So that's what we're trying to do. What we ask people to do, once they've done their little project, they come back and they present to a board. And this board is a group of between 3 or 4 people, normally with Anne from Patients First, who sits and chairs it, and with one of our change leaders, occasionally someone from the executive team, a project sponsor, etc., etc. And we give them the opportunity to present back their work. There's 2 things with this. Number 1, we're checking their understanding. We're checking that they understand what the decoder process is all about and they've followed the process. Number 2, it gives them a chance to celebrate the success and tell people what a good job they've done. Because let's face it, it's not easy to do change in the NHS. It really isn't. So if somebody has the opportunity to have a bit of FaceTime with the senior team and say, look, this is what I've done, then they should be applauded. At the end of it, they get a little lanyard with a yellow tag, and that's good for us as well, because it's a bit of comms and marketing. It's also something, believe it or not, people are really proud of these things. It's like, look what I have achieved, and suddenly you can recognise who's done change in department or who's been through the training and succeeded. So the next course is the Greenbelt training. Greenbelt training is 6 days long, spread over 3 months, so it's done in 2-day sessions. Yes, there are a few more tools and techniques, some of the more complex ones, and certainly a little bit more data analysis. However, what we go into is much more in the way of the softer skills of change management. And the reason we do this, because we ask people at the end of the Greenbelt course to actually do a medium to large scale change project. And what we mean by medium to large scale change is stepping outside of their own department into someone else's world. So something that's going to affect their own department, but actually has far-reaching effects as well. And we support them, we mentor them all the way through. Again, they come back at the end, they present to a Viva panel. The only difference with the panel this time is that we always have somebody from the executive team who chairs it. And it will either be the CEO or our finance director or one of our deputy director of operations, or whoever. But it's another chance for them to celebrate the success. They get a green one. Yay. They also get an off-site visit where we've got very good links with the Royal Air Force just down the road, and they get to visit a Chinook helicopter and all that sort of thing. So there are some good stuff in there as well. So that's the Greenbelt training. Second, the strategic work streams, building the change leaders. To date, 26 white belt courses since 2011. That's 200 plus white belt staff trained. That is a heck of a turnover. We are fighting them off with a big stick at the moment, which is great. Come on in. And it's word of mouth that's doing it a lot of the time, as well as our e-bulletin, our comms and marketing that Chloe is really, really good at. 16 yellow belt training courses, 250 plus staff have been trained. 7 green belt courses, obviously slightly less numbers, 37 green belt staff trained. We deliver all of our courses in-house using our own experience. We don't rely on externals. And we are starting to embed change leaders throughout the organisation. It is working. Second strategic work stream, realising the benefit. Our Greenbelt training now includes comprehensive benefits realisation and benefits tracking modules. Selected Greenbelt projects report directly into steering groups, and some are now contributing to CQuing and SIPS programs and mapping directly into major transformation work that is being undertaken. And projects completed by yellow belt and green belt students are realising benefits in safety, quality, patient experience, productivity, and of course finance as well. And lastly, on the strategic work streams, we are increasing the breadth and depth of the C3I opportunities across the whole of the organisation. I think when the programme first started off, there was a belief that it was just for management level. We've broken that paradigm now. It is available for everyone. So if you've got an idea, you've got the sponsorship from your line manager, come on in. And exactly what you guys were saying, it's for everyone. We've had really successful C3I comms and marketing. That's increased the uptake for the courses. I think it was around about 60% that it's driven up. We've got identification of other organisations and roles that are going to benefit from C3I training. We've got potential partnership projects that are in the pipeline, and now, really proud, we are income generating, so we're actually becoming self-sufficient, which is a big tick. Happy with that. Quick word about the C3I alumni, because I think this is really important, because it's all a part of sustaining. The C3I alumni means that people can share information. We're introducing events all the time that are going to happen, about 3 or 4 a year. We've had 2 major events and a couple of smaller events so far. Brilliant uptake on all. As normal, I've overrun, typical. Just from our projects, post-project feedback, I think the one that really hit home to me was the one from the patient that I've put in red there. It was from a breast clinic, but having been to this clinic 4 years ago for a similar problem, I can't believe the difference. Straight to X-ray, seen on time, all done in less than an hour. And that's through one Yellow Belt project. So if we're starting to make this impact to patients, it's really making the difference. Lastly, other work, course development in the essence of continuous improvement. We are continually evolving. A leadership program, we're actually formalising our leadership program now, so we're linking in with training and development. Extra course modules, as I've spoken about, and going beyond organisational boundaries. Last bit really, and this goes on from what Stuart was asking earlier. There was a general assumption that all improvement work should be delivered as a project. We're starting to step away from everything has to be a project now to problem solving at the workplace. So we're actually looking at the way that we use A3 formats, communication cells and things like that, so that people can actually problem solve at the workplace rather than everything has to be a project. Because if you get too many projects, it becomes, you can't govern it all. So let's try and solve it at the workplace and then reserve projects for the stuff that really matters as well. So try and use the problem-solving methodology, but try and get to that proactive stance. And that is me, and I apologise for overrunning.
I know you, Chris. That's pretty good.
Thank you.
Thank you. Any questions?
Hello. Yeah.
You mentioned there was an introduction of an awareness course.
Yeah.
Is that something that's embedded into the induction?
Right, you've got induction, which is a 1 hour, gives a real generic overview of what Patients First programme does, what the C3I programme does.
I mean when people join the organisation and they go through an induction.
That's their induction, 1 hour in face up with one of us.
Right, so you do a presentation for an hour and as part of their induction.
As part of induction, yeah.
And that covers, sorry.
It covers what C3I is all about, what our philosophy is, what the Patients First programme is, a brief introduction to lean principles. We show a very funny clip of somebody doing something in a non-process flow sort of way, and all it's trying to do is a little bit of a sales pitch, I'll be perfectly honest as well.
I think it's a really good idea. I want to push this.
Fantastic. Yeah, I'll talk to you later about what we include in it.
I really like that.
Yeah, great stuff.
Yeah, it
Hello.
was just when you were talking about the way that you were trying to embed it into the organisation, do you think there's going to be some naturally forming communities practice come out of that? Any naturally forming communities of practice?
Yeah, I think there is actually, and it's funny that one of the things that we've noticed about the culture and the way that things form like that is that rather than talking about lean and projects and things like that, the decoder methodology has actually formed its own sort of culture that people will talk now, and rather than saying, I would like to run this as a project, they said, I'm going to decode the audiology, I'm going to decode ophthalmology, and that's really powerful. It's like, ooh, you're using a language, and then people start to form their own communities because they're talking in that same language, and once you've embedded that sort of language, then you're starting to get some real groundswell and some real momentum. So yeah, thank you.
Like I said to Anne before, it's one of the things is the decoder in that, and all of you will have some form of it, but it's branding.
Yeah.
And when you create a brand and you go around the brand, then it's something for people to hold on to. And you hear people in the language say it. That's fantastic.
And it's copyrighted.
Any other questions? Fantastic. So,
Cheers.
Thank
Thank you.
you. Chris.